Hello, my name is Mike Rust. I'm a candidate for Polk County Supervisor for District 6 in Polk County, portions of Apple River, Georgetown, and Balsam Lake townships. I've lived in Apple River since 1988, moved here from the inner city of Cleveland, Ohio. Quite a cultural experience for my family, even though I was born in Rice Lake, so it was familiar to me in some regards. I live here with my wife, Kimberly Herbeck. We have 3 children and 3 grandchildren. I work at a public interest healthcare advocacy firm called ABC for Rural Health, and have had over the last 34 years advocacy experiences and contacts with thousands of families and individuals around Wisconsin and hundreds of families in Polk County. I was asked in this interview to identify what I thought were some of the most significant issues facing Polk County families and individuals. And in my mind, I kind of divide those into 2 categories. There are things that come to mind right away, the hot button topics that have been for a while under discussion at Polk County Board meetings and other venues around the country. And a couple of those that really sort of top the list in my view have been use of Polk County trails and more recently issues regarding concentrated animal feeding operations, CAFOs. Polk County trails are a significant factor in Polk County's past and I believe in their future. And the issue revolves generally around whether some trails are going to be protected for foot traffic or are going to be able to permit use by motorized vehicles, horses, and other things. Generally, my view on this issue is that I favor the preservation of some trails for foot traffic only. I recognize that in pursuit of that, it is always going to be essential to review the founding mission documents and statements of the trails themselves in order to make sure that whatever use is assigned is compatible with the creation of the trail. Regarding CAFOs, I'm not sure what options yet remain for board decisions, whether there's any options for saying yes or no, or whether it's only issues related to regulating the CAFO operations. One of the things I can say is that I would generally support township ordinance development, and I believe that is going on even now, and also support assuring that county departments like the health department, parks and buildings, and land and water resources have appropriate staffing as well as the freedom to conduct their regulatory functions without undue interference. In my view, though, the most important issues that face Polk County families are those that affect the lives of low-income families, such as affordable rent, affordable child daycare, medical debt, healthcare coverage and financing, especially for particular kinds of mental health care like residential treatment. Also issues like internet access and broadband and transportation. I would support activities already underway at the Polk County ADRC to improve access to transportation for Polk County families and individuals. I would also encourage actions at the Community Services Department to press for Medicaid and Badger Care coverage for residential treatment. And I'll push for the county to take the lead on assuring that families and individuals are well informed about programs that can help them. So things such as health check, other services, Badger Care, over-the-counter medication access for children, the brand new federal special enrollment period for the healthcare marketplace that assures an ongoing special enrollment period for any family under 150% of the federal poverty level. This is brand new. It is not certain that many families are going to know about this without special efforts being taken to assure that. In terms of what qualifications I bring to try to accomplish some of these tasks, I've had about 45 years of public service, beginning as a Lutheran pastor in both suburban and inner city Cleveland churches, and also as a staff person for Lutheran Metropolitan Ministries, a Lutheran social action organization. Back when I was in Cleveland, I was the founding director of the Northeast Ohio Long-Term Care Ombudsman Program in 1977, a program that still continues today. Also at that time sponsored the development of a groundbreaking volunteer guardianship program that is also still in operation as a model program. After moving to Wisconsin in 1988 with the Polk County Health Department, I started one of Wisconsin's first local public health benefits counselor programs in 1988 and turned that program over to the county for operations in 1993. In 2008, I secured federal Medicaid outreach funding for that program that has since then saved the county 50% of its costs for that program and now supports the operations of the Polk County Navigator. In 1995, I helped start the School Home Liaison Program and served on its steering committee for 20 years until the program was folded into the Human Services, now Community Services. In about 2016, I discovered a small clause in Wisconsin's contract with Medicaid HMOs that I was able to convert into an initiative in Polk County between the county jail and economic support that still saves the county thousands of dollars each year in first month incarceration health care costs. It's a program that, being on the county board, might enable me to have a platform to even extend that program to other counties, many of which have viewed it as too complicated to try to undertake, but we've done it very successfully in Polk County. In 2017, I initiated a program that in just 6 months' time reduced the number of uninsured county behavioral health clients from about 400 down to just 26, saving the county and potentially those families thousands of dollars in county tax levy spending. I've served on the board of directors for Kinship of Polk County and for the CRA Domestic Abuse Shelter Program, and I continue to serve on the board of directors for the Mental Health Task Force of Polk County. So public service has been my life theme for many years, and I hope to be able to extend that even to a position of greater influence on the Polk County Board. If people are interested in getting in touch with me, they can call me at 651-341-8097. They can email me, which is actually my preference, at mikkim@amorytel.net. Or if they're further interested, they can check me out at my website, my campaign website, mikerust.org. Thank you.